Good day. We're going to present our paper on proximal and mid-thigh fascia lata graft constructs for arthroscopic superior capsular reconstruction, an in vitro human cadaver study. So in 2013, Professor Teresa Mihata and his group described a wonderful technique, the superior capsular reconstruction for irrevolutive of tears using arthroscopic surgery. However, the fascia lata autograft was harvested through an open approach to the proximal lateral thigh. So in 2015, we decided to perform this magnificent surgery using a minimally invasive harvest of the fascia lata autograft from the lateral thigh also, but as you can see in this video, using only 2 skin incisions, each with only 2 centimeters. And we published our results, our clinical results in 2018, which replicated the results of Professor Mihata and co-workers in irrevolutive of tears. And we also published the results of the donor side morbidity of this technique in 2019 in the Castes journal, and showed that there is no significant donor side morbidity associated with this procedure. So the purpose of this study was to compare the biomechanical properties of the proximal fascia lata autograft constructs as used by Mihata and co-workers and the mid-thigh fascia lata graft constructs we use using the minimally invasive harvesting technique. The hypothesis was that despite the different morphological characteristics of the proximal fascia lata and mid-thigh fascia lata used for arthroscopic superior capsular reconstruction, their biomechanical properties would not significantly differ. So we harvested 40 fascia lata specimens from 10 fresh human cadavers, 6 male, 4 female, average age of 58.6 years. 20 fascia lata specimens were harvested from the proximal thigh of the left and the right thigh of each of the 10 human cadavers, and 20 mid-thigh fascia lata autografts were harvested from the mid-thigh. We measured the thickness of the final graft construct prepared as described by Mihata and co-workers, so with 2-layered with interposed intermuscular femoral septum, lateral femoral septum, and compare the thickness of a 6-layered mid-thigh fascia lata autograft as described in our paper, which results from folding 3 times the mid-thigh fascia lata we harvest, and there is no intermuscular septum interposed. We mechanically tested longitudinally each graft from the 40 specimens and measured the stiffness and the Young modulus and compared using the Welsh independent t-test analysis of variance, and the statistical significance was set as usual to under 0.05. And we found that average thickness was significantly different and greater in the proximal fascia lata graft constructs versus the mid-thigh fascia lata graft constructs. However, neither average Young modulus nor the average stiffness significantly differed between the 2 types of grafts. So the main findings of this study were that the average stiffness and Young modulus did not significantly differ between the 2 types of fascia lata graft construct, despite the greater average thickness of the proximal fascia lata. The strengths of the study were that the sex and the age of the 2 groups, proximal fascia lata graft and mid-thigh fascia lata graft, were equally sized because it's 10 patients and you harvest on the left and right side of the same. Cadavers were fresh, so there was no confounding factors coming from the preparation or the fixation methods of the cadavers because these were fresh cadavers, so you do not interfere with the mechanical properties of the tissues in analysis. The relevance of the study is that it validates the biomechanical equivalence of these 2 types of grafts. Regarding the stiffness and the Young modulus, we have defined the material properties of these types of grafts, which can be used in computational studies about the role of the fascia lata graft in ASCR. And most importantly, it suggests that the mid-thigh harvesting of the graft may be advantageous because compared with the open harvesting of the proximal fascia lata autograft, because the mid-thigh fascia allograft can be minimally invasively harvested, as we've shown, using a reproducible technique with a low donor site morbidity, as the studies we have published before. So in conclusion, despite the different morphological characteristics of the proximal fascia lata autograft and the mid-thigh fascia lata autograft used for arthroscopic superior capsular reconstruction, their Young's modulus and stiffness did not significantly differ. Thank you for your attention.